Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about using something other than just taking a pill for chronic pain management. For the past decade or so, unfortunately, many people who were undergoing chronic pain management treatment were only getting medication management. Sometimes they were getting what's called interventional procedures, epidural injections, facet injections, etc. It seems to be a case of symptom management. This is starting to cause some very serious problems for a lot of people from prolonged use of opioids and sometimes benzodiazepine type medications. And I'm not just talking about addiction either. I'm talking about cognitive deficits. I'm talking about a condition called opioid-induced hyperalgesic effect, where the medications in fact are causing people to feel more pain than if they weren't taking the medication. A hypersensitization of the pain system. That's putting it simply, but that's enough for here. What I want to talk about today is the exciting realm of the holistic or non-pharmacological things that are just totally available for people. If you're watching this on YouTube, please go to the Freedom from Suffering Now blog at the link below, where I've provided a more extensive checklist of many of the interventions I personally use and that many of the patients I've worked with for the past 30 years have used. There are many different alternatives. I believe appropriate and effective medication management is a core piece of chronic pain management in many cases. However, there's also two other components that need to be addressed. One is the psychological, emotional components of the pain, and the second one is finding non-medication interventions so people can start being more proactive in their own healing process. We just have experienced a big problem with overprescribing of opioids and benzodiazepines for people for the last 15 years probably, and it's starting to catch up. You see it all the time. Pain patients are being called addicts and denied services. Pain management providers are having the Drug Enforcement Agency come in and shut down their practice for overprescribing. It's getting to be a real problem. Unfortunately, some of these people that are being charged are not addicts. They are not prescribing inappropriately. However, the criminal justice system is declaring war on pain management. When I work with people, and for my own chronic pain management, I want to have a balance. I want to have medication management, I want to have psychological, emotional pain management, and I want to have non-pharmacological or holistic interventions. A strategic combination of those three core components can lead to really good treatment outcomes and help people stop suffering now. And I believe that freedom from suffering is everyone's right. However, it's also their responsibility to be proactive in their own healing process. I was talking with someone this morning how important it is to move beyond symptom management and look at healing rather than just putting a Band-Aid on it. That's usually what the medication approaches do. It's just symptom management. There is so much more that's available. I invite you to read my full blog, learn about some other choices people have, and share this with someone that you know who is living with debilitating chronic pain and even suffering. Thank you, and check back often.